But let's bring it back to I suppose what you're doing and the work that you're conducting at the moment. Let's get into that. So what really sparked this whole thing that you're doing now, getting people off psychiatric drugs?
What really sparked it? I mean, there's a huge need, and I mean, maybe on a personal sense, I needed to feel like I was actually doing something truthful. I was really struggling to do work that I didn't really believe in, and then I had this degree and this training, and I had a family and a young daughter, and I'm like, what the hell am I going to do where I don't, where I'm not feeling drained at the end of it? And I go, well, there's, I don't really believe in these drugs, so let's see if we can help people come off of them. And thankfully, there's a huge demand for that. I mean, that there's people. I mean, we have people who live in different states where we don't work, who fly out to Utah to meet with us because they're that desperate to get help coming off because they've tried everything else. And so, I mean, really passionate about the science of getting people off. I'm really passionate about the impact that we have when we do this. I mean, when we get someone off these meds, I mean, sometimes they lose like 30 pounds. They're no longer anxious about the side effects of the drugs. Sometimes they're more mentally, they're more emotionally present with their families and their children. If some of them have been hurt, and we work a lot with people who have been seriously hurt, we get to be there with them while they're recovering. Sometimes that takes a few years and they get better, and then it's really awesome to celebrate with them at the end and just say, this chapter of your life is closed. You're no longer anchored to meds or pharmacies or doctors anymore. Go and do what you need to do. And I find it really intellectually stimulating, and I just think it was the only way I could find within my field where I'd be like, I'm actually changing this person's life and in a really helpful way. So it's just been hugely energizing for me. I mean, this is Saturday morning. I do this every Saturday morning. I kind of talk to people and have these conversations, and I just love it. I feel like I've found my purpose, and then what I'm supposed to be doing, and I'm just so hooked into it now.
Yeah, you strike me as somebody who is quite a passionate person, and you sort of, you very introspective. If I've got that correct, would you say that's correct?
Yeah.
Somebody who's very self-aware.
My wife would say otherwise, but I think so.
Yeah, no, but it comes across that way. I can see it, which is wonderful. It's a doctor with a conscience is how I would describe it, and that's wonderful to see. And there's a growing number of people, of doctors like yourself, that are finally, they're seeing that what they're actually doing is causing. I'm not doing it on purpose. I get all that. What they're being told to do is actually causing more harm than good in most cases, I feel. So I'm curious now to get some answers around how somebody would come off medication. Like, obviously this is a very loaded question, but are there some sort of outline steps that you could give that, somebody listening right now, they want to come off the medication, but they don't know what to expect. What could you say to them? What kind of steps would you put in place?
I guess what I would say is it's complicated and it can be dangerous. And so I'm going to plug my own channel right now. But if you go to Dr. Josef on YouTube, that's Josef, it's the German spelling. We have a whole playlist called Tapering Tips, where we kind of discuss the best practices we use in getting people off. But in general, I'll do a simple one. If you're just taking one med and you've been on it for years, the way you get off is very slowly. most of the tapers that I do take between 1 to 2 years to give you a sense of how slow is. You never want to taper in a way where you're going to have severe withdrawal symptoms, because they can be dangerous. And so the idea of coming off, I mean, the mindset you need to have is that I'm going to do very small reductions, and I'm just going to let it kind of be like brushing my teeth. You know, I'm not going to think about it too much, and I'm just going to let it take its time, because ultimately that is the safest way for most people to come off if they've been on the drug for years. There's a lot more nuance in there, but in general, that's the idea. What you don't want to do is be on this drug for 2 years plus and then come off over, 2 to 4 weeks or 6 weeks even. That is way too fast after your brain, because your brain has grown around these chemicals. I mean, it's like the drug is like a scaffolding. It's part of the structure of your brain. And brains aren't that elastic. They can't just, regrow, within a month or so. They need time. And that's why you need to subject the brain slowly to the absence of the drug over 1 to 2 years, so you give it time to rebuild without destabilizing it too much.